possible to have a normal pregnancy after an ectopic pregnancy? A lot of women have been asking me this question. What can they do in order to prevent another ectopic pregnancy from happening? Or what are the precautions they should take? So this is what this video is going to be talking about. So stay tuned to the end of this video and do not miss out on this. Hello everyone, you're all welcome back to Talk Pregnancy with Dr. Nuella. Here we tell you all about pregnancy and other women related health issues. So if you're new to our channel, click the subscription button and also the notification button such that you're going to receive weekly advice on pregnancy and women health issues. And to those who have subscribed, thank you very much. I always love you. So today we're talking about what can you do in order to prevent another ectopic pregnancy from happening? I made a video on what ectopic pregnancy is all about, what are the most common causes of ectopic pregnancy, and how can it be treated. So after this, you can go and watch the video so that you don't miss out on anything. What is ectopic pregnancy? Ectopic pregnancy occurs when the fertilized egg does not implant on the right position in the womb. At times, ectopic pregnancies occur at the fallopian tube. It can occur other places, but the most common place is the fallopian tube. So there is an arrest of this movement of the fertilized egg and does not reach the womb. And what happens when it reaches this place? It cannot grow. It is a very, very tiny place and the baby cannot grow in the tube. So what happens if it stays for long? It can burst this tube. That's what we call ruptured ectopic pregnancy. After an ectopic pregnancy, what next? What can you do to prevent another ectopic pregnancy? It depends on the health of the fallopian tube in order for you to have a normal pregnancy. So it is important follow-up and checkup should be done. So after your discharge, don't just go home. Come back for follow-up. Once the cause of the ectopic pregnancy is identified, it is being treated accordingly. The most common cause is infection. We are being screened for infection, sexually transmitted infection. Most commonly, chlamydia and gonorrhea. Once you had an ectopic pregnancy before, yes, there is no doubt that this increases your chance of having another ectopic pregnancy than someone who has not had an ectopic pregnancy before. So you are at higher risk than someone who is not. But what are the precautions you have to take in order to prevent this? So now it depends on how these ectopic pregnancies too were treated. If it was an ectopic pregnancy which was discovered very early, in that case there's a way which they can go and actually suck out the ectopic pregnancy without cutting off the tubes. But if before you want to diagnose the ectopic pregnancy, it was already late in a way that you had a ruptured ectopic pregnancy, so that tube is already destroyed. If it's that there are adhesions out of the womb, an infection there which can cause the tubes to bend, in that case an operation might be done. Most of the times it's advisable to do like a laparoscopic surgery. And releasing those adhesions is going to release the fallopian tube and make it back to its normal position. So if all these are not checked, if after an ectopic pregnancy you just go home and all this is not checked, or you don't go for a follow-up, this is when these things can still be repeated. Then in other cases, if the scars have been formed, because as an ectopic pregnancy is being formed inside the fallopian tube, and inflammation can occur after that, and if an inflammation occurs, it can all tend to destroy the normal cilia inside the fallopian tube, because there are normal cilia inside the fallopian tube that helps to move this fertilized egg from the fallopian tube into the womb. So if these ciliae are destroyed, the fallopian tube, the fertilized egg, is not going to be moved into the womb. So in this case, when it is really destroyed, it can form scars at that place, blocking the whole tube completely. So it can block that side. When infection occurs, the most likely thing is that it can affect both tubes. So it's very important they check the other tubes. So at times after they've treated an ectopic pregnancy, most of the times it's advised they check if there's any infection and they treat the infection properly. If there were other adhesions, then they'll treat it accordingly. Sometimes it is also very, very important to check the functioning of your tubes. It might be blocked this side and only the other side was partially blocked, which led to an ectopic pregnancy. So it is very, very important. Once you have an ectopic pregnancy, the first thing is follow up. Even though the exact cause cannot really be known, but there are risk factors which should be checked in order to see whether you have this, and it should be managed properly. So in someone who has had an ectopic pregnancy, it is very, very possible for you to have a normal delivery after. What do you have to do is do your test, do your checkup, try to check the cause of this ectopic pregnancy. And once the cause is being identified, most commonly infection, you are being treated properly in order to prevent you from another ectopic pregnancy. And once you get pregnant, the first thing you have to do is visit your doctor to do an ultrasound scan in order to locate where the baby is. Once the baby is found in the fallopian tube again, then treatment will be very early and prevent complications. So if this was helpful, give a thumbs up to our video, and you want us to discuss about anything, drop it on the comment section. And if you want to have a private chat with me, you can follow the link below and book for a consultation. Thank you very much, and God bless you.